Now live on your channel, YouTube.
Yeah, you can see right there. Facebook.
Live on your channel, YouTube.
Hello, everyone. Happy Tuesday. We are using a new platform, so thank you so much for bearing with us as we use this new platform. We're always trying to get better, so we're just trying this out. We can always go back to doing things the way we were, so please feel free to give us feedback. And with that, let's get started. So today we're talking about the Fraxel, and I usually do this webinar annually. And we are entering into laser season here in the Valley. So we love doing Fraxel laser this time of year, usually starting late September through early May because the sun is less intense. So why would we be interested in Fraxel? Fraxel can increase your confidence. It can make you feel like your skin looked 5 to 10 years ago. And it makes you feel powerful when you go out and you feel like you look great and you present yourself to the world with this increased confidence. So not only makes you feel powerful, but it makes you more powerful because you're more confident and feel better about yourself. By the way, I guess I should do a test. Can everyone hear me? Can someone type in if they can hear me and see the slides? Wait for someone to. There you go. Anybody? Can everyone hear me? Let's see. Oh, here. Oh, yes, here we go. Okay. Thank you. Thank you for your patience. Okay, so we're good. All right. So what is Fraxel? Fraxel is a minimally invasive laser. And this laser is called resurfacing. So this is when we take the surface of your skin and basically exfoliate it aggressively and make you look better. So how does it work? It uses these microscopic columns to resurface the skin. And there's a diagram of this on the next slide. And basically these columns go into the skin, they heat the skin, that stimulates your collagen to remodel and your elastin to remodel. Also, it's extremely hot and it goes relatively deep into the skin. So because we're doing a fractionated or a pixelated treatment, this fractionated treatment allows for the safety of the procedure. So if we were doing this the old-fashioned way and treating 100% of the skin at the same time, it would actually be a higher risk of infection, higher risk of scarring, and we'd have to be very, very careful when we're screening patients to do this. But because we're treating in a pixelated fashion, the healing cells only have to migrate a little tiny bit to get to the treated area. And that keeps this treatment safe and very, very effective. So here's that little cartoon I was telling you about. So you can see from this cartoon, there are pixelated columns that are being treated, and these columns go deep into the skin. And you can see that middle layer of skin called the dermis, that's where the collagen and the elastin are. So it hits the top layer, the epidermis, that's where all those brown spots that drive us crazy are found. And then the dermis is where the acne scars are located, skin texture can be improved, the collagen lives, the elastin lives. So because we are able to get those healing cells from a short distance away, we can go deeper into the skin and keep this treatment safe. So the laser that we have here is the newest laser, and it's called the Fraxel Dual. Why is it called dual? Because there's two laser wavelengths. So the first wavelength is the 1550 nanometer wavelength. So this goes the deepest of the skin, into the skin. And the second wavelength is called the 1927. And that is this magical wavelength that helps with superficial texture. So like that crepey or tissue paper appearance of the skin, and also the pigmentation that we don't like. So this laser is really cool because we can customize your treatment. So depending on your goals, the appearance of your skin, and any sort of skin conditions that you have, we can completely tailor and customize this for you. So I talked about safety earlier, but I want you guys to know that this device has been around since 2003. So this was first in class. The Fraxel itself was first in class. Now there's a lot of competitors and a lot of really good competitors as well. But Fraxel is basically the gold standard for this type of treatment. So this was released in 2003. So we have a ton of experience with this device. It's a one-of-a-kind non-ablative fractional technology, and it has many patents. So we've got it's got patents for acne scar, it's an FDA approval for acne scars, pigmentation, melasma, regular scarring, beyond acne scars like surgical scars, etc. So many patents. There's over 1 million treatments performed. So we know a lot about the safety, and also we know a lot about the settings that are most effective for different types of treatments. So that, in my opinion, is really, really important. And then, of course, we know that this works because of all these years of experience, all these treatments done. And there have been many trials and studies done with this device. So again, this just gives us more information that we can translate into helping our patients most effectively and safely. So back when I was in training, this was actually released around the time I was in training, a few years beforehand, but we're still testing it for all sorts of indications. So here are a few publications going way back to 2007, 2008 of Fraxel. And so you can see how long that I have been involved with Fraxel, and I just love this treatment. Fraxel for A case. So actinic keratoses are a type of precancer that, if left for a long time, can turn into a squamous cell skin cancer. Fraxel is actually FDA approved to treat this. Now, insurance will not cover it, but it's kind of like a nice added benefit if you happen to have precancers. And I'll show you an example of this later, because not only are we proving all those other things, but also we're helping to reduce skin cancer. Now, again, not approved by insurance, and there are multiple ways we can treat precancers that are approved by insurance. So I just want to throw that out there. You do not have to spend money from your cosmetic account if you have these precancers. There are other ways we can do it via insurance, and we're happy to help you with that. So here is the device. Here's me, variety of poses treating patients with the device. We numb you. We have a very specific numbing protocol that makes it very straightforward and easy for most patients. We numb you for 1.5 to 2 hours. Treatment itself, less than 30 minutes. And then we have this device called the Zimmer, which will blow cool air on you during treatment. It's very soothing. And then you feel like you have a sunburn, usually the rest of the day, and sometimes a little bit into the next day. But it's nothing dramatic. It's nothing you can't handle. It's more annoying than anything. So here are some of the pre and post care instructions. Very straightforward when it comes to laser. Many of you have seen these kind of instructions before. All right, so this is our beautiful, beautiful esthetician, Meryl. And this is a day-by-day that Meryl did of her recovering from the Fraxel. So I usually tell patients, you're not going to scare small children. Meryl herself has a small child, a beautiful girl named Ivy, but she definitely looks like she's had something done. And whenever we have Fraxel here, we continue to work through Fraxel and talk about it a lot. So of course, Meryl was working while she had this done and did not scare any patients away. She did not scare her child nor her husband. So nothing too dramatic, but you definitely look like you've had a laser done. And then look at day 6, that skin is looking so pretty. And at that point, you're able to cover completely with makeup. Here's our beautiful esthetician, Nadia. I just saw a patient this morning. I told her Nadia is going to be one of the stars of the show. So here's Nadia. And this is probably about a day after she had the Fraxel done. And this is, 2 days. Okay, so this is 2 days after Fraxel. And you can see from this close-up, there's like a sandpaper texture. It's kind of annoying in my opinion, but that's going to all peel off. And when it does, it leaves this baby fresh skin. The skin feels tight. On day 2, you don't have that sunburn feeling anymore. So one annoyance goes away and then you have another annoyance, which is the texture. And then the third annoyance is the peeling. But again, nothing you can't do. And it goes very quickly and it is all 100% worth it. I promise you that. Here's her 4 days after treatment. You can see she's peeling. She's still got a sandpapery texture in places, but you can see after the skin peels, it's that really fresh, brand new baby skin. And we just put on the slide a reminder not to pick or peel too aggressively so we don't have any complications. Here's 5 days after treatment. You can see she's looking great. She's still swollen. That's making her look very young. And then look at her beautiful skin texture on day 5. So you can imagine if she put makeup on and was trying to hide the fact she had treatment, she could probably do a pretty good job. Here's 6 days after. At this point, she can put, enough makeup on to cover any signs of treatment. And you can see her skin has a really beautiful glow and dark spots are fading. Okay, so a little bit on the personal side. I have never had that type of skin that people are like, oh my gosh, you have great skin. And it actually makes me kind of uncomfortable if I do get a compliment on my skin, because I was always that person who was always covering up her skin. So I, even from high school, had a lot of redness and I have a lot of rosacea. I have melasma that started in high school. I have skin that's very acne prone. And unfortunately, I have acne scars because I picked up my acne when I was a teen. So I have all these imperfections and I do Fraxel. I used to do it once a year and now I do it twice a year because I love the results so much. And it's amazing to me, you guys, I get compliments on my skin. And my first compliments on my skin were actually in my 40s. So I just mean this to be kind of like a testimonial to the Fraxel, but also for everyone who feels like they don't have great skin. You probably do. And then you absolutely can have great skin at any age. And so no treatment is perfect. I still have melasma, but I just absolutely love this treatment. This is me, I think a couple of weeks after I had the last Fraxel. And I just, for me, it's one of these treatments that's a real wow factor. And I think almost anyone can benefit from this treatment, no matter what your age, no matter what your skin conditions. It's really, really impactful. So let's see some before and afters. So here's another example of downtime. We kind of went through this already, but you can see nothing major. Here's a patient who had acne scarring. I know the angle's off a little bit, but you can see we couldn't suppress her smile because she has nice, smooth skin afterwards. Will not get rid of 100% of acne scars. In fact, when I was talking about no perfect treatment, my family and I were camping this last weekend, and my daughter was laying really close and looking at me in the morning, and she said, "Mom, what are all those little holes in your face?" And that's my acne scarring, but it will not completely, most things will not completely get rid of acne scarring, but it can make a really, really impactful difference. You can see that in this patient. And then this one as well. So in this patient, I wanted to illustrate, this is 24 hours afterwards. You could absolutely go to social events, go shopping. For this patient, we're focused on her acne scars. So she doesn't have any irregular pigmentation. We're just focused on the acne scars. So sometimes when we do the deeper treatments, you actually have less downtime. So again, this speaks to the customizable nature of this treatment. And also we can adjust for downtime a little bit as well. This patient, we also did Botox to her forehead. So the lines on her forehead going away are from Botox, but you can see, look at the dramatic improvement in her pigmentation and the skin texture. Look at her lower face, and that texture looks just so much better. Here's a close-up of a different patient's skin texture and brown spots are faded, and we can continue to improve that. But we just love this picture because even after one treatment, we can see such a nice improvement in texture. And again, after one treatment, beautiful improvement in texture, brown spots are better, and we can continue to improve upon those. But this is just after one treatment of Fraxel. And again, you can see beautiful improvement in texture, brown spots, tone. It's just a really great treatment. This is a patient with melasma, so hyperpigmentation or dark spots due to sun and hormones and some medications. You can see after one treatment, it's significantly better, where this patient can feel more confident when they are around others. This is a courtesy of the company, but we just wanted to show you different examples, and you can see improvement of the discoloration, the pore size, and the texture after treatment with Fraxel. This is also courtesy of the company, but you can see improvement in the brown spots, improvement in the health and the texture of the skin, improvement in the fine lines as well. Look around the crow's feet area, the lower eyelid area, and even around the mouth. It's just looks better and smoother in those areas. So back to our patients, again, improvement in the brown spots, texture, looks really, really pretty afterwards. Here's a wonderful staff member who volunteered to let us use her full face. And even though she's very young and beautiful, you can see her skin has really improved. She looks better rested in the after picture. Her skin just looks smoother in the after picture. So again, I think patients of all ages can benefit from this. And one thing that's really cool is that not only will this help our skin now, but by making new collagen is like having a tight spring underneath the skin, holding it in and preventing it from sagging forward. And so when we do these treatments, it's slowing down sagging, it's slowing down the rate with which we age. So it's also preventative for aging, which is just really awesome. Here's another patient. You can see that great improvement in the texture. Here's a patient, we were treating him for precancers. And then he got, of course, great improvement in his pigmentation and even in his scarring. He had some mild scarring. You can see his skin is so much smoother after one treatment. That is my lovely husband. Poor guy is always like being subjected to treatments by me. And so here he is, you can see discoloration, some mild scarring on his temples, some redness and readiness on his inner cheeks and his nose, better after one treatment. And I'm trying to get him in for another treatment. This is like 3 or 4 years ago. So trying to get him in for another treatment. I kept this patient in. Many of you have seen this picture before, but this is a gentleman who had a lot of precancers. Look at the red spots on his cheek on the left. Those are all little precancers there. If we left them, good chance he would have eventually gotten a squamous cell skin cancer. On the right, after one treatment, you can see how smooth his skin is. The precancers are gone. They're not gone forever, but they're gone at least for now. And it kind of gives us a blank slate going forward. Also, of course, you can see the wonderful improvement of his discoloration. We can treat chest. We can treat hands. Look at the improvement in my patient's skin texture, her brown spots, but also the skin looseness or laxity is so much better in the after picture. And that's after one treatment. Here's a close-up of another. Actually, this is the company's picture. And you can see not only are the brown spots improved, but the texture is dramatically improved. You don't see the tendons as much because the skin is healthier on the right. All right, so why you should choose Fraxel. No one has perfect skin. We all have imperfections that we would like to address, change, and most of us want to at least slow down aging. And the less invasive we have to be, the better, right? So I usually recommend one Fraxel a year if that's possible for patients. But even after one Fraxel treatment, I think that you will see a difference in your skin. So in summary, you've got minimal downtime. It's very easy for you as a patient. We use numbing and cooling to help with any discomfort, and you will be able to get through this treatment. I have not had an issue with any patients getting through this treatment. It's great for all skin types. It treats many different skin concerns. We can treat multiple areas of the body, and you can get results after 1 to 2 treatments. So it's just a great overall treatment. I would love for you to consider it. So here's what you get for attending. Everyone who attends gets entered for this raffle, and you will get a syringe of RHA filler injected by our cosmetic nurse injector, Maya. So value of $800. And Maya is wonderful. She just treated me with the Soft Wave on Friday last week, and she is very knowledgeable and experienced, and I think you'll love her. And then finally, here's what we've all been waiting for. I'm going to move myself here. And so we have 3 levels of promos, including the one that I've done for you the last 2 years. So the one that we have done is the middle one. And this is a buy one area, get one at no additional cost. Basically, if you do your face, we will treat your chest for you. So because of demand this year, we have to be a little bit stricter with some of these promos. And so I apologize in advance, but this is you treat your face, you get your chest at no additional cost. And with all of these Fraxel treatments, you get a skincare kit, which will be all you need for the best possible healing experience. So these products are really great. They encourage healing faster, and actually they encourage more collagen stimulation during your healing time. I've personally picked out these products for you. So, so this is the one that we've done in the past and has been very, very popular and successful. And I hope you guys decide to do that. If that's a little bit over your budget, we also have a treatment of your face with either Nadia, our lead esthetician, or Maya, our nurse injector. So you get Fraxel of your face for $1,000. And this is basically the lowest price that we've ever offered for Fraxel. So we really, really want you to experience this treatment. And again, that promo is with Maya or Nadia. And then the Fraxel of the face and chest, or Fraxel of face, chest, and neck will be with either myself or Dr. Yonan. And then finally, we have a great promo for you, and it's Fraxel of your face, neck, and chest. You're saving about $1,500 here, and the promo is for $2,100. So hopefully you decide to do one of these for yourself. This is our best promo of the year for Fraxel, and the one on the left is the lowest price that we've ever actually offered for Fraxel. So it's a really great opportunity to do this if you want to try it out. Okay, so there's a few little rules. This is available today only. Please call us. You'll talk to Kayla, our scheduler. She will get you on the books. And then even if you don't know when exactly you want to do it, you can do it anytime within the next year. But to get these prices, you have to prepay today. And then we'll be able to answer any questions you have if you call in. So we're going to go to our model. This is my friend, Yana. She is so beautiful inside and out. And today we're going to treat her. So you can see a close-up of her skin. She sent me these selfies last night. But we have some scarring that we're going to address. She's concerned about dark spots, texture. She has a little bit of melasma. And of course, we all want to help with fine lines. So I will be treating her today. You can say or you cannot say. You will still be entered for the raffle and eligible for the promo. If you get off, you don't have to watch. And then we'll be sending you updates of her as she's healing and as her new skin is revealed. So thank you so much. We're going to pause for a moment and I'm going to switch rooms and we'll get started with our live demo. All right, guys. Hi, everyone. So here we are. This is Yana. Yana, if you want to wait. So we were just talking. She's very excited and she's got some friends watching this too. Thank you, Yana, for sending your friends. Hi, Yana's friends. All right. So what I'm going to do, I treat in sections. So I'm just marking out different sections I'm going to be treating. And each time that, when I'm treating, I guess I should say I work in sections. So I go over each section several times. And then, so Yana, each time it's going to be getting a little bit hotter as we go. But then right when it's like starting to get a little bit too hot, we move sections and it starts over again. So it gets nice and cool. So we are going to be addressing her texture. There's some very fine lines here. There's, of course, some pigmentation. This is going to be so good. I'm very excited, Yana.
Me too.
Okay, great. So most important thing, eye protection. So she's going to put some metal shields on. Yana, it's normal for you to see some light when I'm working around your eyes, but that is completely normal and your eyes are protected. So one thing I want to bring up is that Yana has darker skin than I do. So I use different settings depending on the skin tone and color and how often or when was the last time they've had direct sunlight. And we've talked about this before. And you said you were going to stay out of the sun. Is that right? Direct sun? Yes. Okay. So you've been wearing a hat plus sunscreen. Wonderful. Okay. So again, this treatment is very, very customizable. And so I am customizing it for her skin type. So we're using a setting that is safe for her skin type. All right. You ready?
Yeah, I'm ready.
Okay. Here we go. I'm going to start on your forehead. So I am going to ready the laser, and then everybody has eye protection in my room. And then here's the cool air. It's a little bit loud, so excuse me if you can't hear me too well. All right, here we go. I'm going to move this little hook here, right there. I'm going to start right there. So here we go, Yana. Little hot. What do you think?
Nothing.
Nothing? Okay, amazing. Now, Yana has been numbing behind the scenes with my expert number, Maya, another Maya, my medical assistant. And she is truly an expert number. So like I said, we have a very, very precise numbing protocol that we've hammered out after many, many years of doing this and after an extreme amount of treatments. We, I think, have finally gotten our secret sauce in terms of numbing. And like I said, it's I have no issues with patients being able to complete this treatment. It's really, really easy as a patient. You wouldn't want to do it all day long, but it's not bad for the limited time that we do. So great job, Yana. We'll just go over this area again. You're halfway done with this area. And someone had asked in the chat when the after pictures were taken. For all the after pictures from our practice, they were taken 2 to 4 weeks in general afterwards. So we usually see patients we check on patients after 3 days. We check on patients after 1 week to make sure they're healing properly. And then we see patients back in the office. And usually at that point, we'll get their follow-up photos at the 1 month mark. All right, that section's done. You good?
Great.
Awesome. Okay, we'll finish your forehead here. She's doing so great. Do we have any other questions?
Yes, we do.
Oh, wonderful.
Lorena is asking,
Turn towards me.
is this also called Fraxel with RF and needle?
So this is different than radio frequency with microneedling. I do use it in combination. As many of you know, we do have a radio frequency with microneedling device, and they make a great combination. Remember when I said this is resurfacing? So this is working on the surface of the skin. The RF goes deeper into the skin, at least the device that we use. And so they make a really, really amazing combination, but it is very different. The technology is extremely different.
I have 2 more questions coming in.
Okay.
Steve is wondering if there's a risk of facial fat and volume loss.
There is absolutely zero loss of facial fat and volume loss. So that's one of the things we love about this treatment. Sometimes you hear about some radio frequency devices actually having that risk. And in fact, with our radio frequency device, a lot of times I will use it on purpose to reduce someone's fat, like under their chin, to reduce double chin, to reduce fat in the jowls. So sometimes I do that on purpose. But with this device, there's no risk of losing fat and there's no risk of losing volume.
Sharon is wondering if we can get Fraxel after filler.
Absolutely. If someone has filler, we usually wait maybe 1 to 2 weeks afterwards. Usually 2 weeks it's kind of arbitrary. Sometimes patients come in and I do filler first and then I do the Fraxel. So it is safe to do right away afterwards. But if someone has had filler recently, I'll usually give them a little bit of time to calm down in terms of the swelling, because I want to see their anatomy and I want to plan the treatment. But if I'm able to plan the treatment, I can actually do it same day. And there's actually been studies done that show that the Fraxel will not affect the filler in the body. So in other words, it does not make the filler go away faster. And that's actually proven. So we're very, very happy about that.
Another great question. How long do you have to stay out of the sun before and after treatment?
I usually recommend staying out of the sun direct sun about a week ahead of time and 2 weeks after time. Sorry, Yeneth, last time here. So with Yeneth, I recommended 2 weeks ahead and 2 weeks afterwards. And so again, it's a little bit variable, but usually for almost everyone, it's going to be at least 1 week before and 2 weeks after, but it might be a little bit longer. Turn towards me. Great. Good job.
Colleen is wondering, how is Fraxel different than IPL?
That is a great question. And a lot of times I talk to patients about Fraxel versus IPL because they have a little bit of overlap. So IPL is not going to give you as much downtime as a Fraxel. They will both treat brown spots. However, Fraxel will dramatically improve the texture, whereas IPL will help the texture, but it does a little bit every time that you have an IPL treatment. So I do have some patients who do an IPL every 6 months. They just make the appointment before they leave and they come in every 6 months. And their skin is amazing. They have great texture. They have 0 brown spots. And that's something that we can absolutely do. So that brings up the point of making a treatment plan. And I love making treatment plans with patients because we have so many options. We can customize it to what you want and what fits you, your schedule, your budget best. So if you're on the fence, please come in and let us talk to you about a treatment plan. Great job.
Charity is wondering, so the use of the procedure doesn't make the malaise worse because of the cooling mechanism.
That's exactly it. So we are always cautious about heat and melasma. Last time here, Yana. And so with melasma, I do adjust the settings a little bit. So I use different settings on melasma patients than I do on patients without melasma. And then patients with melasma have to be very cautious with the sun, wear tinted sunscreen at all times, even indoors. And then, yes, this cooling device will help prevent the skin from getting overheated. So combination of setting and then the cooling device and then really diligent sunscreen afterwards will help the melasma and not exacerbate it.
How close can you get the eye area less exposed?
Yeah, so you see where these goggles are, they're metal goggles. So I can get very close to the fine lines, and I was purposely treating her fine lines with this device. I can actually put metal eye shields into the eye right over the eyeball itself and treat the eyelids. These days I do less of that because we can treat the eyelids with radio frequency and we don't have to worry about eye protection because it doesn't use light as its energy source. So I can get really close to the eye and treat the eyelid, but usually we use a different device if somebody wants tightening in that area. Last time here. Amazing. She's doing so great.
The last question we currently have is, how would I be able to get more information on this procedure?
I love the fact that you're asking that. Please call our scheduler, Kayla, and she will answer any straightforward questions you have, or please feel free to schedule a cosmetic consultation with either with any of my colleagues or me. And we would love to answer your questions. So we're just finishing up here. Thank you everyone so much. Yeneth, how are you doing?
Perfect. I'm excited.
You're very excited. So, all right, guys, thank you and hope to see you soon. Great job, Yeneth. You did great.